what is axial spondyloarthritis? It's the title of my talk. Well, first things first, I suppose, it's a chronic form of arthritis that comes from Greek, and it means inflammation of the joint. But effectively, the main symptom is back pain. In fact, the joint that is primarily affected is the spine, well, the joints in the spine, and quite specifically, more often than not, the sacroiliac joint, which is this area of the lower spine is effectively the joint that connects the tailbone or sacrum with the pelvic bone, and is more specifically this portion called ilium. So this is typically affected in axial spondyloarthritis, but it can affect the entire spine. And if untreated, this condition, which is primarily inflammatory, so caused by inflammation, leads to damage of the spine, which leads to stiffness and restriction of movement of the spine, which is normally very flexible. It's a quite common disease, probably more common than we used to think. It's expected to affect approximately 0.3 to 0.7 of the world population. It is thought that 200,000 people in the UK have it, and that is approximately 1 in 200 individuals in this country. So what's the correct term? Axial spondyloarthritis or ankylosing spondylitis? I think in the leaflets you might have found both definitions. Well, let's say that axial spondyloarthritis is the new term, and it's an umbrella, so it's a group term that captures ankylosing spondylitis, which is how it used to be called earlier, and where the changes in the spine are seen on X-ray. And a newer form called non-radiographic axial spondyloarthritis, where the X-ray changes are not present, but the inflammation is. Let's say that in this talk and the following, we're going to be talking about both conditions. Effectively, from different points of view, they are effectively the same condition. So we're going to use them. You're going to use the terms interchangeably and refer them to AS or AXSPA because we like abbreviations, as you I'm sure you know if you've read a medical letter. Okay. So back pain, we said. What are the characteristics of the back pain in AXSPA? They're quite peculiar. So my memory cue is a spine. Often the back pain starts slowly. The onset is not sudden, it's not acute. It comes on slowly over years. It affects the back pain, more specifically the lower portion and the sacroiliac joint. It improves with movement. This is quite specific and peculiar. It does not improve with rest. If anything, it can worsen with rest. Often the patient complains about nighttime waking. The pain often appears in the early hours of the day. Of the morning. So after a few hours in the night, and it appears quite often before 40 years of age. So there are signs and symptoms outside the spine. This can appear not necessarily simultaneously. They can appear over the course of the disease. Eye inflammation can appear in up to 10-15% of patients. Enthesitis, which is the inflammation of the points of insertions of tendons and ligaments into bone. This is the most typical location. It's the back of the heel, the Achilles enthesitis. And then peripheral joint swelling and pain. Some patients might have psoriasis, so it's a condition of the skin that you might have seen. It presents with scaly red patches. Inflammation of the bowel, and dactylitis, which is when a whole digit, a whole finger or toe swells up. So back pain is the main symptom. If untreated, the back becomes stiff, comes with reduced mobility, but effectively the patient is also affected by other signs and symptoms of the disease, like fatigue and difficulty sleeping. This leads, of course, to decreased quality of life and impaired social participation, and obviously living with back pain and joint stiffness impairs work and home productivity. How is spondyloarthritis diagnosed? Well, first of all, often the suspicion comes from the GP. It's made in the general practice. what happens often is that the patient sees the doctor for back pain, which has those characteristics, and the GP, based on these characteristics, like the early onset, the early age of onset, or the duration of the symptoms, starts thinking about a referral to the rheumatologist. And the referral criteria might be family history, current or past enthesitis, arthritis, might or might not request a blood test, about which Professor Bonas will talk about. And if the suspicion is quite high, refers the patient to the specialist, which is often the rheumatologist. And in the rheumatology clinic, the diagnosis is confirmed or not, often with the aid of imaging methods. So there are some investigations that often are requested by the rheumatologist. One is the MRI. You might have had one of these tests before. It's this big tube that works with magnetic fields and allows to detect changes in the organism. It's generally used to make the diagnosis in the early phases, and it detects easily areas of inflammation. What you see here, this is the actual sacroiliac joint with the tailbone, and on the two sides, the pelvic bones. It's also used to monitor response to treatment or to confirm flare. X-rays, it's an older technique, less sophisticated and cheaper as well. Well, we use it now just to detect late stages that are associated with damage, so in long-standing conditions, but also to monitor the disease progression. I'll conclude saying that these are the methods, these are the tools that we use to diagnose, but the diagnosis is effectively based on the clinical suspicion, on clinical examination, on the good old history taking by the GP and the rheumatologist. But the problem is, since there's no unique test that can diagnose ankylosing spondylitis in the blood, and that back pain is so common, the result is that the diagnosis is made too late. There's an average delay in the diagnosis from the onset of symptoms to the diagnosis of 7 years. This, of course, affects the potential to treat the patient effectively and early. And it's even longer than 7 years, up to 9 years in women, because outdated beliefs think that this condition is way more common in men than women, and we know that this is not the case anymore.